Hello everyone and welcome back to the channel. It's time to talk about muscles and more specifically muscular trigger points. Trigger points are responsible for over 90% of all pain and dysfunction I treat at my private practice, Mountain Man Physical Therapy. In this video, I will go into details about what trigger points are, how and why they form, the dysfunction they cause when left untreated, and why so many people believe the false notion that their body will inevitably fall apart as they age. The simplest way to describe a trigger point is a knot in the muscle. When someone says, "I pulled a muscle" or "I strained my back," they are most likely referring to symptoms caused by them. Trigger points present as a bundle of muscle fiber that is locked in a shortened, contracted state and no longer assist us in movement. They can be as small as a millimeter and up to multiple centimeters in size, and can be felt through the skin as a tender bump or nodule, making them very simple to find and treat. There are hundreds of symptoms including pain, weakness, numbness, and sometimes secondary symptoms that are not commonly blamed on the muscles, like dry eyes, loss of vocal range, and digestive issues. I will say it is very rare a patient comes in with unpleasant symptoms that are unrelated to trigger points, and due to only a fraction of a percent of practitioners checking for them, patients frequently get lost in the medical system receiving unneeded and sometimes harmful interventions. Once correctly identified and treatment begins, patients typically experience improvements within just a few minutes, allowing us to know we found the main culprit. If the treatment protocol is correct and combined with other specific interventions, major improvements happen session by session. What I've observed in my practice is that everybody develops trigger points throughout their life, and in order to maintain long-term function and quality of life, trigger point hygiene must be practiced. It's important to understand that trigger points form in the muscles from a variety of causes, such as poor posture, sports, surgery, pregnancy, infection, stress, and several other incidents that commonly occur throughout our lives. Those who are involved in high-intensity sports, stressful situations, or have poor body mechanics will likely experience quicker formation and accumulation of them, leading to a steady decline in their performance. Once trigger points form, partially locking a muscle in a contracted state, they can remain indefinitely and usually do not release on their own. If left untreated for prolonged periods of time, meaning months, years, or decades, they will most likely begin to affect multiple joints and nerves in the surrounding areas and wreak havoc on the body and one's quality of life. Understanding how trigger points behave is also very important and will forever change how you view and treat injuries. Trigger points are typically in one of two phases, active or latent. When in a latent phase, motor function is perhaps the most affected. People will experience symptoms such as weakness, decreased flexibility, early fatigue, the muscle, decreased ability to perform explosive or heavy activities, and increased risk of new and more severe injuries. Despite all of this dysfunction, there is usually little to no pain, numbness, or major symptoms of discomfort. When a trigger point moves into the active phase, symptoms now escalate and our sensory neurons become very active. In the active phase, symptoms escalate to include moderate to severe sharp stabbing and or referring pain, numbness, radiating discomfort, and a variety of more intense symptoms that draw immediate attention. As a result, people are more likely to seek help in the active phase. In the most extreme cases, unbearable acute symptoms can cause people to lay motionless for hours, go to the emergency room, or take other desperate measures to avoid worsening the pain. It's important to understand that when someone with latent trigger points pushes their activity level, they are prone to activating the trigger points, entering the active phase. Pain and other functional limiting symptoms turn on in a sense as sensory neurons begin to fire. This person may believe that they re-injure themselves. However, with chronic flare-ups, it's very likely they just have moved from a latent to an active phase. A perfect example of this is a person who throws out their back several times a year. Most of the year, their trigger points are in a latent stage. They move cautiously and avoid activities that they know could lead to a flare-up. But then one day they bend, twist, lift, or perform a more dynamic activity that catapults them into the active phase, and all hell breaks loose. Those who seek help at this point will often get advised to greatly limit their activities, take pain medication, and undergo injections or even surgery if imaging presents certain abnormalities. Almost never will the healthcare provider palpate and assess the muscles, checking for the most common cause, trigger points. Those who attend PT will typically receive conventional interventions such as electrical stimulation, stretching, braces, and weeks to months of strengthening. It is very rare that conventional interventions combined with exercise will get rid of the trigger points, but if you're lucky, they may move out of the active and into the less worrisome latent phase. As a result, this person is very likely to throw out their back again as they attempt to return to heavier and more dynamic activities. When trigger points are neglected or only partially released, which is the norm, the average person will get caught in a vicious cycle of active and latent phases throughout one or multiple areas in their body. Ultimately, this will lead to major loss of function, postural changes, systemic joint stiffness, becoming more fragile, and decreased ability to be active and enjoy life. But there is hope. Being a serious athlete and taking part in combat sports means my body is getting injured almost on a weekly basis. This is one of the reasons athletes involved in high-intensity sports have such short careers. Before realizing how necessary and simple it is to release trigger points, I suffered from whiplash in my neck for over a decade. Caught in limbo between active and latent phases, I had chronic flare-ups and no choice but to take prolonged breaks from sports as healthcare providers around me were unable to help me. Now I consider these injuries to be the greatest gift in developing the Mountain Man method. My approach breaks away from tradition and rehabs what is rarely considered fixable. After years of experimentation, research, and observing cause and effect, I've been able to rehab all my own injuries using the same techniques I teach my patients. I've created a new progressive form of trigger point release, which is combined with other specific interventions and applied with very specific parameters to assist the body in healing what it struggles to heal on its own. In most cases, even when major defects are seen on imaging, patients still have great outcomes and avoid surgery. Despite being almost 40 years old, I am injury-free and able to go full out with younger athletes in their prime as a result of challenging standard recovery methods. My passion is not only treating patients, but also more importantly teaching people how to rehab their own injuries and ultimately avoid coming to see me for future injuries. Moving forward, I recommend you check out the links copied below in the video description. My goal is to keep this channel accessible enough for people with no medical background to grasp the concepts and learn the life skills of self-treatment. The videos linked below will go into further depth on muscular anatomy, physiology, and the process of trigger point formation and resolution. Please watch them when you get a chance, as they will greatly aid in your understanding of the process as we move further into the fundamentals of the Mountain Man method. In the next video, I will introduce a few simple, cheap tools that every household should have. I use these tools daily in my practice and for my own rehab. For about $50, you can buy all the tools needed to perform the self-treatment aspect of the Mountain Man method throughout the entire body. We are almost ready to start going head to toe treating injuries, so stay tuned. As always, if you have a friend or family member who you feel could benefit from a different perspective, please share a link and invite them to subscribe. If you feel inclined, please also leave a comment below, as it helps promote our video higher up in the search results when people look for help rehabbing their injuries. Thank you again for tuning in, and we look forward to seeing you next time.